So there are lots of oral iron options, and if you go to, a health food store, there
Mm.
might be an entire shelf that is devoted to lots of different iron options, and they really range in price too. And some are packed with all kinds of extra additional things like vitamin C and B12 and folic acid. I always like to start with cheap and cheerful, and ferrous gluconate is probably looking at around $8 for 100 tablets at the
Mhm.
grocery store. They are available behind the counter, but you don't need a prescription to access something like that. It has a very small amount of elemental iron in it. In studies of healthy blood donors, it would take one ferrous gluconate tablet taken every day for about 60 to 70 days to replete the amount lost in a blood donation.
Okay.
Um, just to give you an idea, some people can get constipation, some people get diarrhea, some reflux, um, cramping from oral iron, any dose of oral iron, but lots of people tolerate these without issue. And it's a really nice option for a healthy person who's donating blood or a healthy person who is menstruating,
Mm.
just to take, to get a little bit of a boost.
Yeah.
Ferrous sulfate is like 2 ferrous gluconates, and ferrous fumarate would be 3 ferrous gluconates. And these all fall under iron salt, so they do best when taken on an empty stomach or with
Mhm.
a little bit of orange juice. That's how they're
Mm.
absorbed
Mhm.
best.
Right.
Now, some people can't tolerate that because it makes your tummy hurt. So then we get into some more expensive options. The heme iron polypeptides are really well tolerated. I say it's like having a steak in a capsule. These are the heme as opposed to the iron salt, which is a non-heme type of iron. In my experience, the heme iron polypeptides work very well, but are very slow to work. I just don't see them getting like a big, fast response for people. It can take quite a long time. With the polysaccharide iron, it's more expensive, but you can take it with a meal. You don't need that acidic environment in the stomach to absorb. So some people tolerate these ones much better because they don't end up with cramping, for example.
Right.
There's all kinds of other ones. There's this ferric citrate one. There's so many options. If you find one that works for you, I'm like, great,
Mm.
take that one. Um, Acknowledging that with all the oral irons, um, taking them once a day is more than enough. So even if you're going to take 3 ferrous gluconates, you don't take them 3 times a day. You would take them all together
I
one
see.
time a day.
Hmm.
And that's because it sets off something called hepcidin, which counters your ability to absorb further iron for about 18 to 24 hours. So we know that once daily or even every other day is preferred to multiple times in a day for dosing. And I also want to emphasize the fact that if someone is very iron deficient and anemic, so if a normal hemoglobin is 130 and a normal ferritin is 30, and your hemoglobin is 80 and your ferritin is 4, it could take a really long time, especially if there's ongoing bleeding, to not only build the hemoglobin, which is the first thing that builds in oral iron repletion. It will take an even longer time to build that iron store up. So sometimes people might be taking oral iron for 6 months, for a year, for 2 years. And if they're making slow gains and they're, from a symptomatic perspective, able to do that, great. Otherwise, we have the intravenous iron option, and I think that's on my next slide.